Today, we will be learning about the circulatory system. My name is Ray Valencia. Now, let's do this activity. Problem: what is the effect of exercise on the body supply systems? Hypothesis: exercise has an effect on the pulse or heart rate. Materials to prepare: we need to prepare watch or clock with a second hand with the resolution in second. Measuring your pulse rate or heartbeat: we need to watch this video for our guidance.
Count a radial pulse. Before we get started, let me go over some basic things before I show you the skill. Your radial pulse is the most common site used when counting the pulse rate. The reason is because it's so easily accessible. It's right there on your wrist. Counting a pulse rate tells us a couple things. It tells us the rate, the heart rate of a patient, and it tells us the quality. So while you're feeling that pulse rate, make sure you're paying attention to how well it's pounding. For instance, is it weak or thready? Is it full and bounding? Is it normal or is it absent? Those are all very important details you need to know. So where is the radial pulse felt? It is found in the groove of the wrist on the thumb side. So right now with me, just feel with your two pads of your finger, your index and your middle finger, right there in the groove where your thumb is, and you can feel the pulse. All you have to do is lightly feel it. Do not apply much pressure, because if you do, you'll obstruct the pulse. And never use your thumb when assessing a pulse, because your thumb has a heartbeat of itself, and instead of feeling the patient's pulse, you'll be feeling your own pulse. Next, if a patient has been active, wait about 5 to 10 minutes before you take their pulse. That way they can get back down to baseline. Okay, some other tips when taking a pulse. Whenever you're taking the pulse, remember to assess if the pulse rate is regular or irregular, because that will determine how long you will count the pulse for. If the rate is regular, you will count the pulse for 30 seconds. And after 30 seconds, you will take that number and you will multiply it by 2, and that will be your pulse rate. For instance, say you're feeling a person's pulse and you counted for 30 seconds. And within that 30 seconds, you felt 30 pulsations, 30 beats. You would take 30 and multiply that by 2. 30 times 2 is 60, and that's what their heart rate would be. Now, if the patient has an irregular heartbeat, you would have to count the pulse rate for 1 full minute to get the most accurate result. So now, let me demonstrate how to count a radial pulse. Okay, we have our patient and we've explained the procedure to him about what we're going to do with counting his pulse rate. Whenever you have your patient, have them either sit down or lie down. Here we have him sitting, and what you want to do is you want to have the elbow bent at least 90 degrees and rest the hand on his thigh, and you will take the 2 pads of your finger and you will feel in the groove of where his wrist is located, where the thumb is. You will feel in the grooves just like I'm doing so. Notice I'm not using my thumb, I'm using my index finger and middle finger, and I just have lightly pressed on where the radial artery is. And I will count each pulsation for 30 seconds. His pulse is regular, so I can use the 30-second rule. If it is irregular, remember you have to do it for a minute. Okay, I've counted for 30 seconds, and his heart rate, I got 32, and I multiplied 32 by 2, and I got 64. After you
The purpose of this experiment is to see how well the heart is working in yourself and to help find out if the heart is pumping enough blood. Now, these are the normal heart rates by age. You are going to do an experiment in a group of 2 people. Please find a partner. Place the tips of your 2 middle fingers shown in the video on the side of the wrist of your partner shown in the photo below using a stopwatch or clock. Take your partner's pulse at rest for 1 minute, 60 seconds. Record the number of beats in the data table. You can use the 30 seconds counting, but you need to multiply by 2 if there is a regular heartbeat. Take note, regular heartbeat. Example, pulse rate counts in 30 seconds time is 35 by 2 equals 70 beats per minute. But you can still use the 60 second or 1 minute as a regular counting if there is a irregular beat. Activity number 2. The same thing. Measuring your breath rate or respiratory rate. Please do watch the video for your guidance.
Hey everyone, it's Sarah, the registered nurse, RN.com, and in this video, I'm going to give you some tips on how to count a respiratory rate. So counting a respiratory rate seems like a pretty simple skill, but it can be tricky, especially if you're first starting out and you're trying to collect all those other vital signs on top of your respiratory rate. Plus, some patients, it's easy to count their respiratory rate, while in others, it's not. First, let's quickly review how to count a respiratory rate. So a normal respiratory rate in an adult is about 12 to 20 breaths per minute. But not only are we counting that rate, we're looking to see if the breathing is labored or unlabored. And an example of labored breathing would be like this. And notice how the patient's chest, we can really see it moving up and down. They're using their mouth to breathe in and breathe out. Also, we're looking at if the breathing is irregular or regular. So irregular breathing would be patients taking a breath here and there. It's not on this consistent rate. They may like take a breath in and out, and then there's a pause, and then they'll breathe again here and there. A regular rate would be there's a consistent rhythm to that breathing. Now, if the rate is regular, you'll want to count for 30 seconds and multiply by 2. However, if the rate is irregular, you'll want to count for 1 complete minute. So when you go to count the respiratory rate, you want to make sure that you are doing it manually rather than going by the number that's on the monitor. Because as a nurse, I have found that that number that monitor gives you is usually not the rate that your patient is breathing. So always double check that. Now, whenever you do go to count the respiratory rate, you want to make sure that the patient isn't really aware at that time that you're counting the respiratory rate, because they will alter the way that they're breathing. It's just like if I told you I'm going to count how many times you blink. You are going to alter how much you are blinking. You will change it. So whenever you do this skill, you want to combine it with checking the pulse rate. So you'll feel on the side, the radial side, the pulse rate, count that like you normally would. But then you're going to keep your finger on that side and count the respiratory rate. But the patient thinks that you're counting their pulse rate still. And what you're looking for is the rise and the fall of the chest. 1 rise and 1 fall of the chest equals 1 breath. But this is where the tricky part comes into play, because it's like, how do I determine what's a rise and what's a fall of the chest so I can count 1 breath? And here are some tips to help you do that. Now, with these tips, you're going to find in practice that some of these tips work great on some patients, while others you may have to change it up a bit, because every patient is built differently. They're going to be wearing different clothes. Like some patients are going to wear a gown, some may not even have a gown on, and some may be wearing their regular street clothes. And a lot of patients, they have different disease processes going on. So one thing I like to do, if I know this patient, it's going to be hard to count their respiratory rate, I'm going to get down at the level of their chest, like their shoulder and chest area, and their abdominal level, because I'm looking at that rise and that fall of that chest. I'm getting down here, looking at that while I'm checking that pulse rate. So I start out in that position. And some patients, it's really easy to tell depending on how they breathe. Like the shoulder area will move up and down. The chest area will move back and forth, or the abdominal area will go up and down. Now, if your patient has like a severe disease process where the respiratory system's being affected, like with congestive heart failure, a lot of fluid volume overload, they have trouble breathing. So they're going to use these abdominal muscles to help pull in and out that air. You can actually just see the abdomen going in and out. So that's really helpful whenever you're trying to figure out the rate. Another tip you could do, but I would use this with discretion, depending on your patient and how they are, would be Whenever you go to feel that pulse rate, you can lightly put your hand on their back, on their chest, or whatever, so you can feel the rise and the fall of the chest. But with some patients, like if they're agitated, confused, or they're just someone who really doesn't want you in their personal space, you wouldn't want to use this, but with some patients you can. And my last tip would be to group it with your physical assessment. So whenever you're going to assess the chest, you're going to listen to heart sounds and lung sounds. What you want to do is tell the patient, I'm going to listen to your heart sounds for 1 full minute. So while you're there listening to both heart sounds and the lung sounds, they're not going to think that something's wrong. So you're going to take your stethoscope, and first you can listen to their breath sounds and count that rate. It's best to try to pick an area that you want to count that rate where there's not a lot of adipose tissue, because that can really muffle those breath sounds. So generally at that second to fourth intercostal space anteriorly, about mid-clavicular, that could be a great place to count those breath sounds. But again, it really depends on how your patient is built. Then after you count.
Now, as you see in the picture, these are the normal breathing of a person, depends on the age. You are going to do experiment in a group of 2 people. Please find a partner. The same of the instruction given earlier. Okay. Also, you can use the 30 seconds count if there is a regular breathing. But of course, irregular breathing, please use 60 seconds or 1 minute. To count 1 breath, you need 1 rise plus 1 fall equals 1 breath. The BPM now stands for breaths per minute. All right. After that measurement at rest, have your partner run in place for 3 minutes. All right. Immediately count your partner's pulse or heart and breath respiratory rate. Record the 2 rates. Wait for 5 minutes and count your partner's pulse and breath rate. Record your rates. After doing that, reverse the role and let your partner count yours. Please see below example of table to follow. All right, this is what you need to follow. Okay. After your table, answer the questions. What is the effect of running on your pulse rate and respiratory rate? What is the effect of running on the body supply systems? How does your hypothesis compare with the result of this activity? Last, why did your pulse, After your table, answer the questions below. What is the effect of running on your pulse rate and respiratory rate? What is the effect of running on the body's supply systems? How does your hypothesis compare with the result of this activity? And why did your pulse or breath rate decrease after 5 minutes? Instructions. Get a partner to do this experiment. Get a paper, draw the table as shown earlier to record your data rates. Do the measure one at a time, your partner, and then you. Answer the question given above. Take a photo, submit it to the line in private. Thank you so much, and I do hope to see you again on our next video lesson. Bye-bye.